So Robert F. Halliwell is a professor of clinical pharmacology at the University of the Pacific in Stockton. Thank him for being here today, driving up from Stockton. He previously held lectureship in neuroscience at the University of Durham, England, and research fellowship at the University of California, Irvine. Dr. Halliwell undertook graduate training at University College, London, at Nine Wells Hospital and Medical School at the University of Dundee in Scotland. His lab is addressing the value of neurons derived from a variety of human stem cells for studies in neuropharmacology and neurotoxicology. He has also published work in the history of medicine. So thank you very much for being here.
Okay, thank you very much, Shiva, for inviting me, and what a great turnout. So some of you will have detected I have a strange accent already. So if I say anything with an English way of saying things you don't understand it, please stick your hand up and say that in American, because I have 3 American kids as well who can speak both American and English. I'm still learning the language. Okay, so I'm going to try to... So I always put this slide up to remind me who I am, because I'm getting to that age right now where I need to be sure I know still who I am and where I'm at. And the date, it's always very important. It's 11th of June. I'm supposed to be at this Brain Fitness Forum at the Jewish Community Center of San Francisco, which is where I am right now, correct? Thank goodness for that. So that's good. So 2 out of 2 so far. Okay, so this presentation I do, occasionally for community folk, to try to encourage people to live long and healthy lives. And it's based upon my training and experience in some clinical work with the brain and neurology and psychiatry. So I don't know whether the title of this presentation in the program you have is How to Maintain a Healthy Brain Without Really Trying, but that's really what I'm trying to give you some information about today. Because there's lots of new information coming through, good studies, good scientific clinical studies showing that healthy lifestyle doesn't have to be complicated, and it doesn't have to be difficult to maintain a good, healthy brain. And this is incredibly important, to maintain a good, healthy brain, not just for your emotional well-being, but for your physical well-being as well. We know that with good mental health, you have good physical health as well. And the two are interlinked, actually. They both feed off each other. So this is a scan of my brain, without my wig on, to introduce the topic. So as I speak, if you have a question, I'm very happy to take a question as I go through this presentation. And I shall try to keep to time so that everyone has a 15-20 minutes break before they watch the movie in this room. So the first thing I want to tell you is that we're all living a lot longer than we did 100 years ago, or even 50 years ago, actually. So you can see from, is there a laser pointer or any kind of a pointer in here? Probably not. Probably. Okay, not to worry. So I don't tend to read off slides. I try to supplement what's on my slides, but hopefully you can all see, even those of you at the back. My eyes are not so good anymore, but I can see my slides from here. So it says U.S. life expectancy hits record high of nearly 79, actually 80 years. And this is from the CDC, the Center for Disease Control. And it was published a couple of years ago. And it says that we're living longer because we live healthier lifestyles. We're living healthier lifestyles because we eat better quality food, we have better sanitation. It's not all these drugs that are out there that cost lots of money. And stress us being able to afford them. But actually it's as a result of exercise, good diet, and maintaining a good, healthy brain and community engagements. There's a couple of things to note from this new data that we're all living longer. Women still have an advantage over men. They're living at least 2 or 3 years longer. Men are living to the age of about 80 now, and women are living to about 83 years of age. So you retire at 65, let's say, and you've got a good 20 years or better in front of you. So it's very important to maintain a good, healthy brain to live a good quality of life in those retirement years, if you choose to retire, of course. And if you believe in God, which I do, clearly God's a little bit biased in favor of women. Maybe he's giving them a break from having to deal with men all of their lives and giving them a couple of years of, low stress before they go to meet the Maker. Anyway, so, so another really nice, I think, piece of data that sets the background for wanting to encourage you all to live healthier mental lives is that this slide shows you that if you can make it to 65 years of age, the likelihood is you're going to make it much longer, up until the 90th year or beyond. So what this slide's showing is in 1940, that's at the bottom on the x-axis of this histogram, bar chart really, is you can see that only about 7% of people, if they live to 65, only 7 in 100 of us would go on and live to be 90 or more, right? Only 7%, that's a pretty low number. If you jump forward to 1980, that's 40 years later, you can see that actually by then, the stats show, the data shows that if you live to 65, 25% of us, 1 in 4 now, would go on and live to be 90 years of age or older. So we're living longer, and we've got a better chance to live up to a very grand old age if we can make through the first 65 years. And you can see if we add now another, 75 years onto this, jump from 2000, which is the latest data. You're predicting now, CDC is now predicting, Center for Disease Control is now predicting that if you live to be 65 in the year 2050, most of us may not quite make that, I'm not sure, but hopefully we will, that almost 1 in 2 of us will live to be 90 or beyond that. So we're living a lot longer lives. So you retire at 65, you've got maybe 35 years at that stage for 1 in 2 of us. So it's very important to recognize that. So a number of Americans age 65 can expect to live to be 90 or more. You can see it's increasing significantly from 7% in 1940 to nearly 50% by the year 2050. Does that all make sense? Great. So some of you learned ones will know that Shakespeare thought of 7 stages in life. Started off in infancy and ended in the 7th stage of life in complete oblivion. If in the play As You Like It. I mean, I had to read some Shakespeare being educated in the UK, and an interesting author to read. As a neuroscientist, I know actually that there are really only 4 stages in life. There's the first stage in life, which is where you're using milk. This is showing a bottle of milk, but breast is by far best. The second stage is when you're a teenager, and you're drinking sodas all the time, which are really not very good for you, but we all do it. And then you get to my stage, our stage in life, where maybe a glass of beer or a glass of whiskey in the evening to chill out is the way that you end the day. The stage, and that's the third stage for a neuroscientist's life. The fourth stage, of course, is the one that you want to put off as long as possible. This is the saline drip. When I put an IV line into you and put you on saline, you want to put that off as long as possible and keep me well away from you as long as possible. That's the fourth and final stage of life. Okay, so hopefully I've convinced you all that we're all living a lot longer, but you must use your brain to maintain a good quality of life. So I know that, notice the previous speaker, I don't know whether he's still here, said the brain's very, very complicated. Far too complicated for you all out there. I disagree with him. I'm going to make you all neurologists in the next 30 seconds or so. This is the human brain. It's rotating around. It's showing you that it's composed of 100 billion neurons or nerve cells. And in top of that, there's about 1,000 billion background cells called glial cells or glue cells. It sticks everything together. We used to think they were just the sticking cells for the neurons, but actually we now know those glial cells, those glue cells, actually do a lot more in maintaining good, healthy brain and providing nutrients and support. The brain is composed of this 100 billion neurons, 1,000 billion glial cells, and they all are interconnected. There's something like a quadrillion connections or synapses between nerve cells in the brain. And it's a supercomputer, really. And of course, that supercomputer is using electrical and chemical means to communicate between cells. And it's the connection is the so-called synapse. That's where two cells connect and send signals to each other. And so the signaling mechanisms involve chemical transmitters, as you all probably know. And lots of the drugs out there that we use for therapeutic purposes or for recreational purposes, even alcohol, but the more addictive drugs like cocaine and heroin, they modify those chemical connections in the brain. They change the levels of activity such that people will hallucinate, feel euphoric, and so on, and sedated. And it's this connection, this electrical chemical events that are very important to maintain in healthy brain aging. So you're all somewhat now semi-qualified to be neurologists and treat others. And now, so now I want to tell you a little bit about some basic facts about your brain as we age, as we get older. First thing is that as far as we can see, the maximum lifespan of a human being so far has been 122 and a half years, confirmed. That's as long, and that was a French lady called Jean Calment. She lived to be 122 and a half years of age. She rode a bicycle till she was 100. She smoked until she was 116 years of age. The tobacco companies are probably very happy about that advert for them. She ate 2 pounds of chocolate every week. She swore by eating chocolate, 2 pounds of chocolate. And actually, I'll tell you later on, there's some evidence that eating chocolate is good for your brain. Absolutely. And that's easy, isn't it? That's an easy thing to do, eat chocolate. So she's the longest living human being known on record, 122 and a half years. She bathed in olive oil, I think, quite frequently as well, swore by it to maintain her skin. But anyway, so that's as long as we can see we can live right now. Most of us won't make that stage. But as you grow and you get older, your brain weight decreases. That's because you're losing brain cells. From the age of the mid-20s, you start to lose brain cells. Probably lose about 30 million cells a year. That sounds like a lot, but when you think you had 100 billion neurons in your brain, it's a very small proportion. But that is a fact of life. You do lose brain cells as you age. The connections in the brain start to diminish as well, especially when you don't use the brain. So the connections start to break down. And then one of the big telltale signs of aging, even in those that are not demented, that don't have memory problems, is that there's a development of plaques and tangles. These are the telltale signs of Alzheimer's disease, actually, but it doesn't mean to say you're demented. And I think the speaker this morning, I didn't hear it, but apparently he talked about Alzheimer's. Presumably he talked about plaques and tangles and probably talked about drugs. And I heard some controversy about what he said about everything depends on drugs, correct? I don't know what he said, but someone cheered when they said, the second speaker said, I disagree with what he said. And I don't know what he said, but for sure, drugs are useful, but they're certainly not the entire answer. In fact, the healthy brain aging depends on exercise, communication, and lots of other things, which I'll talk about in the next few minutes. Anyway, so plaques and tangles are also an indication of getting older, and they're almost inevitable for most of us, but it doesn't mean to say you'll become demented. All right, so brain aging is very difficult to see because you can't see the brain, but it's not always a pretty sight. If we could look at the brain, here's this poor individual here aging through time. I don't know him very well, but I contemplated which way to put this slide, which way to put it, upwards or downwards, and I thought, let's hope this is a stairway to heaven, right, rather than a decline to hell or whatever. So, anyway, it's not always a pretty sight, as I'm told frequently by people that know me too well. Okay, one of the advantages of aging healthily is that you can become a multitasking person. As you can see, this good-looking gentleman here is illustrating the great benefits of aging gracefully. He can multitask because he can laugh, he can cough, sneeze, fart, and pee all at the same time. So there are some benefits to getting older. Some may agree or not. Okay, so with that said, here's some data, hard data if you like, showing the risk of developing Alzheimer's disease, which is one form of dementia, memory loss if you like. in the American population, as you can see, keeping it really simple, you can see that there are three bars. There's a red bar, a green bar, and a blue bar. And that's really just showing you at each age the likelihood or the number of people that have been diagnosed with Alzheimer's disease. So you can see, it's these three bars are displayed for 2010, 2020, 30, 40, and 50. So it looks a bit complicated, but it's not. It's just showing the numbers of people. The only thing to really focus on here is that Alzheimer's disease is a disease of aging, of getting older, actually. And you can see that clearly in any of the sets of three bars, the red, green, and blue. You can see that as you get into your 70s, the risk jumps enormously from when you're in your 60s. There's just, in this slide, in 2010, less than 500,000 people in their 60s that have got Alzheimer's disease. But if you look the numbers of people in their 70s with Alzheimer's disease or 80s, it's 2 and 2 million people. So the risk increases markedly as you get into your 70s and 80s. That's all that slide is showing. The other thing this slide is showing that is over time, as we go forward up to the year 2040 and 2050, there are more people going to be, unfortunately, seen with Alzheimer's disease because we're living longer and the population's aging. More people live longer, population's increasing. So that's why the bars are going up. So you can see we're predicting by 2050, we probably have about 15 million people in the United States with Alzheimer's disease, simply because people live longer and the population's growing. So that's important to recognize as well. Now, I noticed that the previous speaker talked about there's lots of reasons. I think he mentioning that there's lots of reasons why you can get dementia. And actually, this slide shows you that, again, hopefully slightly more colorfully with this pie chart, and then the different reasons that you might become demented, having memory problems, language problems, emotional problems. Right at the top of my list is Alzheimer's disease. That accounts for about 70% of everybody that we see in the clinic that's demented. Okay, it's got memory loss, language problems, become emotionally unstable, start to get lost. Eventually they stop speaking, they don't recognize anybody, become akinetic, that means they don't move, and they become mute. And then people succumb to that and die. 70% of people that we see with dementia have Alzheimer's disease. It's a particular pathology, it's a particular reason for causing dementia, and the hallmarks of that I'll show you in the next couple of slides. But there are lots of other reasons why you might become demented, and that includes cerebrovascular disease. In other words, poor circulation into your brain. Poor heart function leads to poor blood supply and oxygen supply to your brain. You don't think so well. That's the second leading cause, actually. Then after that, there are these things called Lewy body dementias. This is where you've got these abnormal protein deposits forming in your brain, and it leads to dementia. Then Parkinson's disease. Those of you who know something about Parkinson's know it's a movement problem. People have balance problems, postural instability, they shake, but they also become forgetful. And that is often not realized out there, but actually many patients with Parkinson's disease become also demented. And then there's an older disease which used to be known as Pick's disease, but now it's called frontotemporal dementia, which means the frontal parts of the brain and the side parts of the brain start to deteriorate, and that leads to dementia. That's another reason why you might become demented. So when somebody says you've got dementia, and it's possibly Alzheimer's disease, they're kind of guessing right now. There's some tests which can indicate it, but not fully prove it until post-mortem, actually. So there are lots of reasons. Alcoholism, God bless you. Alcoholism, infections such as HIV/AIDS, syphilis can lead to brain damage, brain tumors impinging upon the memory systems of the brain, vitamin deficiencies, or as you would say, vitamin deficiencies. That's an American word, I can say it properly. Stroke. You have a stroke, it damages parts of the brain, like the medial lobes of the brain, medial temporal lobes of the brain, can lead to memory problems. And of course, trauma in motor car accidents, motorcycle accidents. Did you have a question? What about marijuana? Marijuana, we don't know very much about that right now. In terms of memory functions, there's lots of claims for it, but it's still under investigation. I can address that later on. But I get asked that question all the time about marijuana. And the answer is we don't really know. Okay, so here are some risk factors that, in a sense, you will need to be aware of, because some of them you can avoid, right? So, for example, obesity. Being overweight increases your risk of developing dementias, whether it's Alzheimer's or cardiovascular dementia or whatever type of dementia. is the underlying cause, obesity increases your risk of developing dementia in later life. Diabetes, uncontrolled blood sugar. Through poor diet, hypertension, high blood pressure, increases your risk of developing dementias. Smoking. So you avoid smoking. You avoid head injury. You know, these football players that use their heads as battering rams. I mean, that's not very clever. In the long term, it's not a good idea. And of course, avoiding infections. We want to avoid infections. That's a no-brainer, right? Tumors, again, we don't choose to develop tumors, but they can develop. Vascular disease, that's really saying keep a good, healthy heart function, and that way you will reduce the risk of having vascular disease, atherosclerotic plaques developing in your blood vessels and leading to stroke. And then there's some genes associated with, and again, we don't select our genes, we get them from our parents. But there are a couple of sets of genes like presenilin 1 and 2 you may have heard of. These are genes that slightly increase the risk of you developing, for example, Alzheimer's disease in later life. Now, and also this ApoE4, apolipoprotein E4 gene. It's a particular type of gene. These genes are associated with either early onset Alzheimer's disease or later onset. Early onset means before the age of 65. Between the ages of 40 and 65, people develop Alzheimer's. Very low risk. The risk of developing late onset, which is over the age of 65, is associated with this particular gene, ApoE4. But actually, those genes only account for probably 1% of all people that we see in the clinic with Alzheimer's right now. So even if you inherit those, it doesn't necessarily mean, you know, you're going to go on and develop it. And it accounts for a very small proportion of people that develop dementias. The more likely problems are obesity, diabetes, hypertension, poor cardiovascular function, poor diet, head injuries. So these things you can, certainly these are life choices to be, yes. Sure. Yes. Yes. So it's a good question. That so the question was, if your hypertension is controlled using medicines, does that negate the risk? And it will partly offset it. Yes, absolutely, it will. Yes. And I don't work for any drugs companies, so. Okay, so just to make you a neurologist and pathologist now, I'm just going to show you a cross-section of a brain that has half a brain on the left side as you look at this slide, normal brain, and a half on the right side of a brain that has degenerated as a result of Alzheimer's disease. The things to notice really are, so the grooves, the outer parts of the brain, that's the gray matter. That's where all the cells are that do all the thinking for us, our computers. The white matter that you see in there, the white bits of the brain, those are all the axons, the fibers of the nerve cells crisscrossing through the brain, making connections with other brain cells and other parts of the nervous system, including the spinal cord and out into the periphery to control your muscles and receive information from your sensory systems. So there's gray in the white matter, although in this slide, of course, it's brown and white, or orangey and white. And you can see there are some grooves in the brain. They're called sulci. Sulcus is singular, and the gyrus are the sort of peaks of the mountains. There's a called gyrus or gyri in plural. You can see there are some language centers on the side of the brain. That's the lateral temporal lobes, and on the medial parts of the brain. Those medial parts are actually very important for memory formation. You can see that's the normal looking left side of the brain. The right side has succumbed to a patient's brain to Alzheimer's disease. And what you see is the grooves in the brain. You see the sulcus has got much wider. And the cortex, the gray matter, has got a lot thinner. And then you can see these ventricles. These are these fluid-filled spaces in the brain. They've got cerebrospinal fluid. They've expanded because the brain has shrunk. So the fluid-filled spaces have simply expanded, filling in the spaces really as a result of brain cells being lost. And you can see the memory areas that are boxed on the medial temporal lobes on that right side. That's gone a lot thinner and degenerated, and the language centers on the lateral surfaces of the brain have also degenerated. So that's why we see people, that's the first signs of Alzheimer's, is people start to become forgetful. Short-term memory goes away, and then later they have problems with language. They forget words, and then they can't name things, and then later on it's not only forgetting what they're doing, what they're supposed to be doing, but forgetting names of people, where they've been, they get lost, and they become agitated, and they wonder, and they get lost, and so on. So these are the sort of signs, and that's all as a result of the brain degenerating, and that's what it looks like. The final sort of telltale sign, and I'm just focusing on Alzheimer's disease, which is the main cause of dementia. 70% of people with dementia are suffering from Alzheimer's, so hence I'm focusing on that. The final indication, diagnostic feature actually, of Alzheimer's disease are these so-called plaques and tangles that are in the brain. So on the left side is a normal image of 3 nerve cells in the brain, and you can see there's a cell body, it's called a neuron, and the genetic material is right in the middle there, it's in the nucleus. It doesn't really matter. On the right side, you can see there are things called tangles inside the cells, and on the outsides of the cells are these so-called plaques. And those are the telltale signs, actually, of Alzheimer's disease. And we can only see those at post-mortem. So we make a sort of working diagnosis in life when you're coming into the clinic and you've got problems of memory and people say you're becoming forgetful, getting lost. Then we can do some basic tests, and there's some newer drugs now that we can test as, to support our diagnosis. But ultimately, we can only make a formal diagnosis of Alzheimer's disease at post-mortem, when we can look in the brain and see plaques and tangles. Now, plaques and tangles are a part of normal aging, and in fact, it doesn't mean to say you will become demented, but these are the telltale signs. So, how do we slow down the degeneration, and how do we minimize or completely avert the problems of developing plaques and tangles in our brain? So that's what I'm going to tell you now. And I'm not quite sure what time it is, so I'm okay for the next 15 minutes, 10 minutes, okay? So I've made you neurologists and pathologists, so we've done pretty well in the last 30 minutes or 25 minutes. So the question now is, how can we use that information to slow down our to some extent, inevitable decline if we don't take precautions, and reduce the risk of dementia, whether it's the Alzheimer's type or frontotemporal or Lewy or whatever it is. So here are some tips. So very simple, and as I said, this is how to maintain a healthy brain without really trying. A good night's sleep. You don't have to try very hard. I mean, I know we have to try often when we're stressed and we've got things on our mind to get to a good night's sleep, but good, healthy sleep habits, like going to bed when you're tired, having a dark room, a cool room, not having the computer on, not having the cell phone on, not having the radio or TV on, is a good, healthy lifestyle. And sleep habit to get into. A good night's sleep is very critical for healthy brain aging. Reading is very important for healthy brain aging. It exercises memory, it exercises attention and recall. So these are very important, simple things that we can do to maintain a healthy brain. Avoiding stress. You might say, why avoid stress? Well, when you're stressed, you release cortisol. This is a stress hormone. We know that cortisol, you put cortisol onto brain cells, if you put it on long enough at high enough levels, it kills them. So we know that cortisol is not good for your brain, so stress is not good for your brain. And healthy diets. Having fruit and vegetables, very important to maintain good, healthy brain function. In fact, very good and important for all physiological functions. I show this because this slide is of a Navy pilot. It happens to be my son flying inverted over Arizona a couple of years ago. Probably shouldn't show that, but anyway, we're very proud of him. But he's got a super stressful job right now. He's flying off an aircraft carrier in the Middle East. And I've got a really easy job by comparison with him. So he has a super stressful job, and I think I have a very nice job. But avoiding stress is very important for me and for him as well. Okay, so what about the importance? I said it's important. Well, there's lots of data out there that can support the... Yes? Yes, that's a good question. Avoiding stress is not always possible. So then dealing with stress is the only option we have, right? And there are techniques, of course, that the psychologists can suggest and train you in, and even self-help methods to address and deal with stressful situations. And that's very important to recognize that, yes. Say again, sorry? Well, the cortisol will always be released. When you're stressed, the cortisol gets released. And by adopting and developing and learning techniques to reduce your stressful response does ultimately lead to reductions or fall off in cortisol levels. So, conscious of the time, just to support the importance of sleep, these are observational studies. They're not cause and effect, but it's simply you make an observation and associate it with some particular outcome. So, for example, we know that if you're a person who habitually has poor night's sleep, you're also more likely to develop hypertension, high blood pressure. We know high blood pressure is not good for your brain. It leads to increased risk of heart attacks and strokes. It also leads to an increased risk of type 2 diabetes. That's what that T2D stands for, type 2 diabetes. And obesity as well. Also is a consequence of poor night's sleep. Because people wake up and get up and can't sleep, so they go downstairs and make a midnight snack or whatever it is. So all these things are not very good for you, ultimately. There are lots of experimental studies. I'll take one more question in there because I'm going to finish these slides, but go for it. Okay, so the question was to get 6 to 8 hours. I mean, 6 to 8 hours as we get older is not always necessary. We sleep as long as we need to sleep. We go to bed and should sleep when you're tired and wake up and get up when you've had enough sleep. It doesn't necessarily mean you need 6 to 8 hours. 7 hours probably is great, ideal, but it's not necessary for everybody. Taking sleep medications is not recommended routinely because it disrupts the natural sleep cycle. So the short answer is not to become dependent on all these sleep medications like Ambien and what have you, and Sonata and all the other ones that you see advertised on TV all the time. Simply because it puts you to sleep, but it's not a natural sleep. And we need to go through the natural stages of sleep, or natural cycles of sleep. Okay, so I'm not going to go over all of this, but there are lots of experimental studies that show that when you disrupt sleep, you disrupt brainwave patterns, you disrupt cognitive and emotional functioning, you change appetite hormone levels, you change cells and you increase the damage in cells, you change gene expression. Genes that are being turned on and turned off all the time are affected when you get poor sleep quality. So there are lots of physiological consequences that we can now measure that we didn't used to be able to measure. So sleep, very important. Okay, here's another easy thing to do. You like coffee or tea? For me, I drink tea at home and coffee when I'm at work. There's data now showing that caffeine, or possibly the caffeine in coffee, has some beneficial effects. A couple of cups of coffee a day looks like it can reduce the risk of developing plaques in the brain. When you do an experimental study in mice, and you give them the equivalent of 2 cups of coffee a day, and these mice are genetically bred to develop those plaques that we see in Alzheimer's disease, you reduce the development of those plaques in those animals when you give them the equivalent of 2 cups of coffee a day. So that's indicative that maybe coffee has some beneficial effect. I mean, it's a stimulant, of course, wakes you up in the morning, right? But also it may have components inside coffee, caffeine in particular actually, that may well impair the development of those plaques in the brain. So that's an easy thing to do, right? You drink coffee, it may be a good thing. Don't be a couch potato. What about tea? Well, it also has caffeine in it, so it may well, it's just, they didn't study tea, they looked at caffeine, it looked at coffee effectively. But tea should also be theoretically helpful, potentially. As long as it has caffeine, exactly. That's the thought anyway. So don't be a couch potato, because then you become overweight. And there's lots of studies out there that have shown that people that don't maintain a good normal weight age more quickly and become more forgetful and are less competent cognitively than people that become obese are less able cognitively than those that maintain a normal weight. And there's studies I could talk about, for example, with the British civil servants who have been studied. Some studies recently showed that you monitor these people between the ages of 55 and 65 before they retire, and you give them a bunch of simple little tests, memory problems, problem solving, recognition tests. And those that maintain good, healthy weight during those 10 years do better than those people that become obese in the same age span. 55 to 65 years of age. So, obesity hastens cognitive decline, you could say. Exercise, we know, is very good for the brain. This physician now is explaining to his young patient, what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? And I know it's a difficult question there, and I'm going to give you a little bit of time to think about it, but I'm going to write you a prescription for exercising 1 hour a day. Okay, so here are some examples of how well you're exercising. Okay, you're sitting at your computer, you think you've done a lot of work that day, you've been sitting at it for an hour. That means you've burned off the equivalent of 1/3 of a Snickers bar. Okay, so when you eat that full Snickers bar, you need to sit at the computer working really hard for 3 hours to burn it off. 1 hour of chewing gum is the equivalent of burning one Pringle off. What about a long run? I try to run 3 times a week. I try to run 3.5 miles 3 times a week. 1 hour run, I can burn the equivalent of a Big Mac and fries off. I did have some slides. I wasn't sure it was appropriate in this set about sex and the difference between men, but I took it out because I wasn't sure how sensitive you all were. I think this audience could have handled the sex, but next time, sex, drugs, and rock and roll next time. Okay, what about the busy evening socializing? Well, you've been dancing for 1 hour. That's the equivalent of burning those 3 glasses of nice red wine you drank in the socializing. Okay, so as getting towards the end, important thing is to know that it's never too late to engage in lifestyle changes, including exercising. So this study, it's been repeated it was originally a study that was published in Norway, and it's been repeated in the United States more recently, showing that if you exercise for 3 hours a week, that doesn't mean to say running. It means doing some gardening or walking around the garden or walking around the park. 3 hours a week, you can add 5 years to your lifespan. And even if you start in your 60s or 70s exercising, we know that that can have a beneficial effect and add to your lifespan by up to 5 years. Because those who don't do it live 5 years shorter. It's easy. Well, walking around the park, doing some gardening, getting some fresh air, 3 hours a week can add 5 years to your lifespan. Not complicated. What about red wine? People in here probably enjoy a glass of red wine. Everyone, perhaps occasionally. There are compounds in red wine. There's something called resveratrol that's in there. It looks like it has some protective effects against brain aging. It seems to have a number of beneficial effects, but one of them is to reduce brain aging, improve cognition. But to translate the experimental studies to human beings is difficult, because the amount of red wine, or the amount of resveratrol, which is a component of red wine, it's in grapes and raisins and things like that, to get the beneficial effects would require you have to drink something like 60 liters of red wine a day. So, I mean, maybe some people out there can handle that, but me being a Brit, American Brit now, I like a beer. I went to medical school in Scotland, so we drank whiskey and beer all of the time. It's remarkable that I even got through the program, but anyways. So beer also may well have some beneficial effects. A study published just in the last year actually showed that people that routinely had a few beers during their week in their lifespans had a reduced risk of developing plaques and tangles in their brains when they went to postmortem, compared with those that never drank beer. So there might well be some components in beer, and it might be antioxidants, things that inhibit the development of components in the brain that damage cells. The beer may have antioxidant properties. Okay, so beer might well be beneficial. It's easy, again, something very easy to exploit. Okay, for those who like chocolate, there's also data now showing that a few bars of chocolate a week may well reduce brain damage and brain aging and improve cognition. So this has been repeated both in Europe and in the United States, showing that people that like chocolate perform better cognitively, little tests of memory, problem solving, than those that don't eat chocolate routinely. Now, it's not necessarily cause and effect, but it's an association. So it's worth thinking about, right? Chocolate, beer, wine, and sex is all you have to remember to go away with today, right? And I know this is a very liberal city in San Francisco, so I can say these things, right? Stockton a little bit different, of course. Okay, so I should finalize. So here's a very famous genius, Albert Einstein, and the question is, did he take cognitive enhancing drugs? No, he didn't. Are cognitive enhancing drugs useful? There are drugs out there that some of you will have heard about, like Ritalin and Adderall, which are being used by some people, not clinically used, but used to improve cognitive processes, thinking, memory. They're stimulants, really. There's another drug called modafinil that's out there. These drugs are sort of being suggested to have an ability to improve thinking and memory. The evidence is very slight. For cognitively normal people, these drugs do not do very much. So don't turn to these internet sites that say, take this drug, it's going to improve your memory and speed up your problem-solving abilities, because the data is very weak that they do anything other than take your money. What about these brain training exercises you hear about now all the time? Hear it on NPR and on the TV, Lumosity, right? Brain training exercises improves your memory, improves your problem solving, your calculations, all that kind of thing. There's a lot of neuroscientists met recently in Washington, D.C., and they came to the conclusion that these claims are somewhat overhyped. And the evidence so far is not strong that they do anything other than you make, these brain training exercises, you get better at them. You do problems, if you do crossword puzzles, you do them all the time, you get better at it, right? If you do these sort of recognition problems, math problems, you get better at it. The question really is whether these training exercises generalize out to your general cognitive abilities to problem solve, to be emotionally stronger, to recognize and calculate things better as a result of these trainings. And the data from my esteemed colleagues is, the conclusion is, from looking at the data so far, is that these brain training exercises are somewhat overhyped. Somewhat overhyped. Okay, so a very strong sign for me as a neuroscientist of your age is where you wear your belt. You can see right now, I'm in the somewhere between adult and middle-aged level. I know you're getting very old when you wear your belt just beneath your chin. And I don't need to do anything else. Okay, the reason I show you that, and I've put some slides in that have some humor in them, is because laughter is very good medicine. We know that laughter is good for your brain, reduces stress, and actually people, when they've, and I'm trying to finish on time, when you enjoy humor, actually when you're tested on your ability to solve problems or your memory abilities, if you've enjoyed a humorous event or you're in a good mood, you actually perform better than those that haven't enjoyed a humorous event or just... So a very simple study that was done not so long ago, 2 or 3 years ago, done in Southern California at Loma Linda University, is they looked at 3 groups of people, and to cut to the chase, one group was tested on some memory problems and problem-solving abilities, and then they were left to rest. Another group was given the same set of problems to solve, and then they were shown a movie, was a humorous movie, and then they were retested on their ability to remember what they'd seen and the problem-solving. And the ones that saw the funny, humorous movie performed much better when they were subsequently tested than those that were simply sent away to relax for 20 minutes or half an hour. So humor clearly had a beneficial effect on their brain function. So humor's good for you. Okay, retirement may not be very good for you. We know that and again, the data shows that when you retire and you simply become a couch potato, you increase your risk of depression, hypertension, diabetes, all kinds of, and cancer risk. All increases when you retire and don't do anything else after that. So don't retire and stop functioning. You must maintain activities. And the thing to do is to maintain what you're doing here today, which is a community engagement. We know that if you maintain community engagement, for example, teachers that go back to schools help out as teaching assistants, function much better than those that simply retire and do nothing. So I'm aware of that. So I'm going to conclude with, so exercise your brain throughout your life, and I would say thank you very much for your attention.